Hey guys, here is my half kneeling hip external rotation with band assisted tibial internal rotation. I'll show it to you, then I'll coach you through it. All right, so I use this drill to try to coordinate the arch, the tibia, and the femur moving in the directions they should be moving as I'm doing sagittal plane exercises. So what I mean by that is if I externally rotate the femur as I bring it out there, then my tibia should actually perform a relative internal rotation, which the band should assist in that because it's pulling it that way. The arch of my foot should actually create a higher arch as I externally rotate. So I got to focus on tripod foot, keeping ball of big toe and heel down on the floor as I go out. So we have external rotation, that's a glute squeeze, tibial internal rotation assisted with the band, but I'm also firing up some of those medial hamstrings right here to help with that internal rotation. And then high arch, so I'm squeezing my arch as I do this and making sure that the ball of the big toe is traveling towards the heel and the heel is traveling towards the big toe to get that arch. On the reverse, when I come in, I should actually be feeling a little bit of femoral internal rotation, tibial external rotation, and a flattening of that arch. Okay, so when I'm here, I'm squeezing some inner thigh groin stuff. I feel maybe a little activation up through that hip pocket. I am feeling outer hamstring kind of work to externally rotate that tibia. And I'm feeling the arch of my foot smush down into the floor. So this is a complex one. I'm trying to coordinate 3 joints at once. Glutes for the hip with external rotation, medial hamstring for the knee with tibial internal rotation, and arch and ball of big toe center of heel. Coming back in, I feel inner thighs, tibial or femoral internal rotation, tibial external rotation for some outer hamstrings, and arch smush. All right. Some troubleshooting things. You need a sturdy object to attach a band to. That's on the inside part of the leg, and the band is just below the knee. Sometimes this pulls on the hairs on my leg, so I'll just take a block and do something like that and keep that in place. All right? And then when you switch sides, I'll have to make sure that my left leg's the outside leg, so I would spin around in this case. That is my half kneeling femoral ER, tibial IR with a band assist.